Hi, I'm Dr. Sheridan Mish from Life Power Chiropractic with offices in Utica and Wampsville. I wanted to put together this video to help people who are suffering from low back pain and sciatica. I know with the current events and the concerns that people have with coronavirus that people are social distancing and maybe not able to get out to see their doctor. They may not be able to see their chiropractor. And I wanted to put this together to help people in our community that are suffering. So I'm going to show you a series of stretches that you can do every morning and actually throughout the day. You really can't overdo them. And it's a sequence that you're going to be able to do in your bed when you wake up. You could also do it on the floor if you like. And there's also a maneuver that can be done while you're seated, and I'll show you that too. So one of the things you want to do when you first wake up is you're going to be on your back, let's say, and we're going to start with a single knee stretch. And so what you do is you're going to take one knee, bring it up towards your chest, and what you're going to do here is take 3 deep breaths in through your nose, out through your mouth. And with each breath, pull that knee closer to your chest little by little. So take a nice deep breath in, and then out. And pull, and then breathe in and out, pulling a little bit more, and then one more time, and you get a nice stretch just like that. You're going to let that go right back down. Now, some people may have difficulty getting into that position, so the way to help modify that is if you bend your knees first and then you bring it up like so, that can also help make it a little bit easier for you for people who have some flexibility issues that they're dealing with. And so then you're going to want to make sure you go and do that with the opposite leg. You're going to bring it towards you, take that breath in and out, in, out, and then one more time, breath in, and as you breathe out, just pull a little bit closer. Great. After you've done that for each leg, you're going to do it with both. So you'll bring both knees up, pull them like so, and you're going to bring both knees towards your chest with the same breathing sequence. Breathe in and out. Hold it, breathe in, out, and pull a little bit further, and one more time, and then out. And you're going to let that go. After you've done that, the next step of the progression is going to help a lot with sciatica. And this is a key muscle that it's going to help stretch that piriformis muscle in your hip, and that's where the sciatic nerve runs through. And so what you're going to do is you're going to bring the one leg up, you're going to turn it like so, and then take that knee and bring it towards your opposite shoulder. And as you bring that across, you're probably going to feel that stretching right in this area here. Same sequence. You're going to take that breath in and then out. Breathe in and then out. And then one more time. And pull it a little bit further each breath. Let that go. And we're going to do it the other side. Bring the knee up. Turn your leg. And then pull towards the knee, towards the opposite shoulder. And again, breathe in and out, in, out, and one more time. Getting a nice stretch there, and you let that go. The next step to the progression is you're going to lay on your side. And when you lay on your side like so, it's okay to have that pillow underneath your head to provide that support. And what you're going to do is you're going to take your top leg, you're going to bend it, you're going to take your ankle and put it under the opposite knee. And what you do with this is this knee should now be touching the bed or the floor wherever you're doing this stretch. You're going to lock that in with your hand and make sure that you keep that there. You want to keep that knee down. And then take your shoulder and arm and stretch back like so. Like I said, some people, if you've got some neck issues, you may want to have a pillow there. Other people, I recommend typically to have your head just flat like this. And so what you do is same thing. Take that breath in and out, and with each breath, you're trying to get this shoulder and arm down to the floor or touching the bed. And as a tip with this, what you can do is you can also apply some stretching tension to your fascia, which is going to help get a better stretch throughout your leg, hip, and your back. And you can do that by just taking your hand and gently pulling on your skin while you're doing that stretch. So you can pull in those different areas along your leg and hip and your sacroiliac joint and in your lumbar spine, just pulling that back. Of course, we're going to go and do that on the opposite side. Take the top leg, bend it, take your ankle, put it underneath your knee, lock that knee right down, making contact with your bed or the floor. Let this arm come back, and you're going to take those breaths. And as I said, with every breath out, you try to get that arm to go further down. You can also pull along the skin, tractioning the fascia to help get a better stretch all the way. Now, once you've gotten through that, you're going to want to go and roll onto your stomach. And this is a progression where you can start off, and maybe for some people, they're only able to lift their chin just like this. You can go from that to this where you're up on your elbows and you're stretching. And again, taking those breaths. Breathe in and then out. And with each breath, you want to try to go backwards. The next step of that progression is to come up onto your hands. Same thing. Breathe in and then out. From this position, you'll go like this. Same thing. You want to take those breaths, and with every breath you take, you're going to settle back a little bit further here. Then you go into this position, you do what's called the cat-cow stretch. And with this, you want to rock and tilt your pelvis and let your head drop down and bring your shoulders and your back, your thoracic spine between your shoulder blades up. Take that breath in and then out. As you breathe out, you're going to transition from the cat pose to the cow. You let that belly come down, tilt your hips and pelvis, and then bring your head back like so. Breathe in and then out. And transition. Cat. Cow. The last maneuver I'm going to show you in this position is the piriformis stretch. Again, this is going to really help to target that sciatic nerve and where that gets impinged in your hip, where that piriformis muscle is. And so similarly, when you're trying to stretch for this, when you're laying on your back, we're just going to kind of reverse it here in this position. What you do is you're going to take the one leg, you're going to have it bent, you're going to turn it like so, and then the way that you bring this shoulder to this knee is that you bring it across here, and then you come down like this using your body weight, and this knee is coming toward that shoulder's coming down, and you're holding that stretch, breathing in, out, and you let it set in a little bit deeper. Stretching that right out. And then of course we're going to switch to the other side. You're going to take that knee, make sure that that's up. The other leg's going back a little bit so it comes up. You're going to lift that knee, turn your foot in and across, trying to get that knee toward that shoulder. We're going to bring that shoulder down, and you're just going to stretch right back. Push in a little bit further, and again, you're going to be feeling it right in there. The last part of the sequence, you're going to do that piriformis stretch while you're seated. You'll be able to do that in your bed. You could also do it on a chair as well. I'm going to grab a chair here and show you how to do that. So now you're seated up, you're going to have that good posture, and you're going to want to be a little bit towards the edge of the chair or the bed. Come forward a little bit there. Same principle here with the stretching is you can stretch single knee like we were doing when you're laying on your back, and again, breathing. Same thing with the other side. And then to stretch that piriformis to really target where that sciatic nerve is going through in the hip is same thing. We're going to take this knee, bring it up, we're going to turn the leg, and we're going to bring this shoulder to this knee. So we're going to come forward like this, bringing it closer. Every breath in, and then out, bringing it closer a little bit further. Breathe in, and out, in, and out. And we're going to do the same thing with the other side. Knee comes up, turn your leg, bring this shoulder to that knee. Bringing it forward here. There we go. This stretching sequence can really help provide a lot of relief to you, as well as any family members that are suffering. I wanted to, again, just let you know that we are here to help. Chiropractic care is an essential service in New York State. We are open through this coronavirus crisis, and if you have any questions, don't hesitate. Please give our office a call at 315-280-0586. You can also like us on Facebook, and you'll find us under Life Power Chiropractic, Dr. Mish, and we have a Utica office and a Wampsville office. You can also go ahead and follow me on Instagram. It's at Sheridan Mish. I look forward to helping you get through this crisis that we're dealing with here nationwide, and also, most importantly, helping our community get through this so we can be stronger on the other side. I know that we're going to do great, and that I'm telling you, it's all going to be okay. Let's continue to work together, shop local, support local businesses, and I thank you for taking the time.